Hi, friends. This is Dr. Ravi Kamapale. I'm an infectious disease, wound care, and obesity medicine doctor, and I'm in LaGrange, Georgia, where I have my clinic, and it's a combination clinic of all my three specialties. And in this complex healthcare, I'm trying to weed through the complexities that I face as a clinician, and I try to solve my problems of healthcare delivery for one patient at a time. Now, I'm an infectious disease doctor, and people keep asking me why I think combining complexities of different aspects of siloed healthcare into trying to deliver one simple solution for one patient at a time. So, what I call this approach that I am trying to kind of change is a mindset of what I call is mass medicine mindset, wherein with this mass medicine mindset, sometimes we are able to develop theories and we are able to come up with some solutions that are kind of towards helping groups of patients, but it doesn't really help that one patient at a time. And that's where I think the problems are associated with healthcare delivery. We are approaching it like a mechanistic thing, like say an aeroplane is flying and aeroplane is can be the flight systems are so improved and there are no accidents in aeroplanes, and so we need to take that model. Yes, we need to take the good in that model, but it just comes down to a complexity of human physiology and anatomy and makeup is so nuanced that what works for one person will possibly not work for even his twin brother or sister. So that's it. What I want to bring together today is two of the studies that I came across. This was, let me flip the thing here. Okay. So this was one of the studies that was interesting. It is like infectious disease study, but it was from a JAMA article that was published on June 21st, 2021. It is external validation of a widely implemented proprietary sepsis prediction model. I mean, it is one of the models like EHRs or EMRs are becoming the wave of how healthcare is delivered. And I think there are multiple EHR companies, and I guess this model was using Epic sepsis model. Epic is another EHR that is there. But what they have done is Epic kind of is an amazing system where it was developed to help with a delivery of solutions for complex nature in which healthcare is delivered using their proprietary methods. Now, we are trying to develop different proprietary systems, but I think the problem with proprietary systems are they are not open for evaluation easily for outside people. Now, what happened here is normally when people are admitted, sepsis is identified, but in this study, almost they had 27,000 patients, and basically the patients they were identified with their sepsis criteria was only around 183 of 2,552 patients with sepsis, which was only 7%. And the problem with that was that what they looked at is administration of antibiotics and highlighting the comparison problems. But what was the problem is that when the external review was done, they did not identify around 1,709 patients, which is 67% of them. So why am I really showing this? At least from a system standpoint, thinking about this kind of complex healthcare delivery models, understanding where we are, we need data systems like Epic or other companies doing it. But healthcare is so complex that we cannot deliver these solutions easily without trying to come up with unique solutions. Now, sepsis by itself is an end game of medicine. And as I do this healthcare, I know that I am playing the end game of medicine. And another study that really caught my eye was this amazing thing with COVID. Obviously, COVID is taken over the world for good or bad. And I think there is something good that is going to come out of this COVID process, like, say, hastening and improving the healthcare delivery models with telemedicine technology. And to tell you, in 2014, I was one of the investors in a startup company that's trying to do this. So I'm revealing my bias for that. But that said, the healthcare delivery has with COVID has changed, and this was one of the things that I want to bring to the front for you guys to understand that this was a study. Now we know that we have been showing that obesity and hypertension are associated with bad risk of outcomes or increasing bad outcomes in hospitalization. And this was a study that was from March 29, 2021, wherein it showed that hepatic steatosis, that is fatty liver, increases the risk of obesity. So narrowing it down. So it just comes down to understanding that it is just not the obesity per se, but also they looked at around biobank of 502,000 patients in UK biobank. And obviously, these people had positive COVID, a few of them, and then 41,000 underwent MRI, and they looked at the data. Then that data revealed that obese patients with fatty liver were at increased risk of hospitalization and bad outcomes. Now, that's where the population health helps. Now how we change this population health idea and improve the outcomes of a person is what is more important. Like, say, how we can take this population health idea and now work on improving the outcomes is what we have to focus on. Like, say, a simplistic model, like how we can take reduced carbohydrate intake. It improves the insulin sensitivity and reduces fatty liver. And obviously, when they lose weight or reverse diabetes and reduce pancreatic fat or fat on the liver, then you improve diabetes. So just in case here, you need to understand that insulin pushes glucose into the liver or muscle or fat and causes the whole problem. So in healthcare, the problem is complexity of delivery of care of each person at a time. Now, why did I talk about these two studies is, as much as sepsis or infection is an issue, we need to understand that changing the person's outcomes does not depend upon creating more business for the healthcare providers or health systems, but also it has to be thinking of removing barriers to healing, preventing the revolving door of healthcare, empowering the patient using democratizing models of delivery. Yes, that's where artificial intelligence will still come in, or augmented reality will come in, and healthcare providers need to be more focused on learning about healthcare delivery models wherein they empower the healthcare change and be a part of it. And hoping that this was the message that I was able to deliver today, I would be happy to further connect and make things better in Georgia and in US and across the world, and also in India, which is my goal of life, to improve health for one person at a time all across the world. Thank you very much. Have a great day.